My name is Dale. I live in San Jose, and my story is about my experience of what should become the public option. In 1994, I lived in Seattle, Washington. I was on disability, and after a long process of working up through GAU and then suing the SSI system and the SSDI system to become a disabled American, I accomplished that. I had a surgery on my throat at that time on Medicare, entirely covered. I was having my throat realigned, basically, for apnea purposes. That was my disability. And in my experience, the Medicare coverage provided no deficit of care or attention from the staff. I was on complete general anesthesia. I was completely out. It was a really super invasive procedure, and then 2 days later they sent me home. They would have done the same for anybody on a private insurance situation at that time. To contrast with that experience, 2 months ago I had a kidney stone blasted right here in Silicon Valley at the Los Gatos Community Hospital, which is a tenant hospital. And the surgery, instead of costing $10,000, which my surgery did in '94, which was on my throat, it was nearly $47,000. I am having to pay now between $5,000 and $7,000 of my responsibility. My husband and I, we are having to come up with this money at a very difficult time for both of us. I'm currently on state unemployment for state of California. My husband is an editor at the Mercury News, which is rapidly shrinking. It is possible there will be no Mercury News any day now. On the plan that we have, which is a PPO plan, for God's sake, we are having to come up with $5,000 to $7,000 at a time when his salary has just shrunk by 7%. It is due to shrink again to a total of 9% in January. It is also possible that he will have no job because the Merc may cease to exist entirely.